I'm Robert Guest. I'm the foreign editor of the Economist magazine, and I'm joined by a wonderful panel here today to discuss the innovation that's happening in what's frankly the most important area in the world at the moment, dealing with healthcare. So let me welcome our panelists. We have an audience here, we have an audience remotely, and likewise we also have panelists here. We have Konstantin Efimienko, who's the founder and CEO of Biopharma, an innovative Ukrainian healthcare company. And we have Thomas Hach, who is from Novartis, and an expert on personalized medicine. And we also have joining us remotely Maya Matthews, who's the head of performance of health systems unit at the Health and Food Safety Directorate General at the European Commission. And I also believe we have Arjan Tur, who's the chief executive of Cigna Europe, and who is just joining us back on the screen. So I'd like to thank UFuture very much for sponsoring this session. And we're going to have questions from the audience to all the panelists, and we're going to have questions from online, which have been sent in, and we're also going to have some polling questions. But let's kick off by talking about the big issue that's really obsessing the world for the past year and a half, the worst pandemic probably of anyone's lifetime here, certainly the one that's had the broadest effect around the world, even if it hasn't yet killed as many people as HIV/AIDS has. And the extraordinary rapid response to it, the rapid discovery of a vaccine, the rapid discoveries of ways of treating it. And it's all, it's part of a big hurly-burly of health innovation that's going on in the world. Just in the past couple of days, we've seen the World Health Organization approving a new vaccine for malaria, a problem that had stumped scientists for decades, certainly since I started out in journalism. I'm going to start with a question for Konstantin. And I believe he's going to answer in Ukrainian, possibly, or Russian. And so you should have translation equipment here, which, if you set it onto one of the channels, will be in whichever language you'd like to hear it in, assuming it's either Russian or Ukrainian. So, Konstantin, perhaps you could tell us then, how big a deal was the rapid discovery of the vaccine? And what do you think the spin-offs might be? What have we learned about how to innovate?
Well, with the emergency of the vaccines in the end of the 2020s, I think we have understood two main important things. The first was that in the very specific situation, they accelerate the regulatory activities and they accelerate the governments. And the governments of the US and Europe, they also come to the certain support and certain discounts even for the sectors, and certain things can be accelerated even by 5, 10, 15 years in advance. Why that happens? We are used to these traditional vaccines, the so-called inactivated vaccines, when the virus has been already killed off. The vaccines that we currently have, most of them, like none of the vaccines that we have, that has been already based on the inactivated vaccines. We already have the Pfizer, BioNTech, and Moderna vaccines. Those are the matrix RNA, so basically RNA. So this is something that we have already had. This is the very first time that we have used that with people. So this is the RNA molecule that has been used. We have had the replacement of the amino acids there, the piece that looks like SARS-CoV-2 that actually causes some response from the body. All of the other vaccines, for example, like AstraZeneca or the Johnson & Johnson vaccines, those the adenovirus vector vaccines. They're also known but have never had a big usage for people. We had some cases when they have been used for the prevention of the Ebola virus, but they have never been widely used for people, treating so many people before. So basically the clinical and the preclinical research that usually lasts for 10 or 15 years, they have been ended up in a year and a half, and we have actually seen how the both MDA has closed its eyes and they've decided to issue these vaccines as well. We can discuss it as well because it can give us the floor for the new technologies and vaccines. What are the other consequences that we have understood for ourselves as well? This is in connection with Ukraine as well, that the wealth is still disseminated unequally, and Ukraine has received the vaccines, one of the final countries all over the world. In 2020, we didn't have the access to any vaccines at all. In 2021, we just have started to have them. Our colleagues from different international organizations, they told us, you don't have to build your industry, you don't have to build your plants here, we will provide you with all of that. But what we have seen that we have received the vaccines the last time right now. And if the methodology of UNICEF have not showed it in the 2020, at the very beginning of 2021, I'm speaking about the UNICEF in Ukraine. At the very beginning of 2021, they have started speaking calmly, okay, come on, vaccinate. Then right now at the final TV show by Schuster, I have said the position of UNICEF. They've told, why should you develop your own industry? We have now 30 million doses of vaccines, so we can give it to you so you can use it freely. There are two outputs for me. This kind of pandemic, it will accelerate the situation of creating any kind of technologies, and the European Union as the two biggest regulator, they will be stepping out of any kind of norms, and they will be intensifying it to support and save humanity. And we have to understand that countries as Ukraine, they should take care of about themselves on their own. So those are the consequences for me out of those crises and the vaccines that we've had.
Thank you very much, Konstantin. That was a very spirited opening statement. Now, I'm going to ask a polling question to the audience, which you can answer on your phones. And then while you're answering that, I'm going to go to one of the live speakers here, and then we'll come to the speakers who are joining us remotely shortly after that. So the question is a very simple one. Do you think that COVID-19 has transformed the healthcare sector? And you can answer 1 for yes, 2 for no, and 3 for to some degree. So if you want to have a crack at answering that, while I put a question to Thomas. We've had a very spirited intervention on the difficulties of getting vaccines to Ukraine. There's also a problem with people not wanting to take them. Now, this is a global problem. It's not just in Ukraine. And it's a very big problem because this is not just people saying, I don't want to eat my vegetables. This is something where if they don't take it, they risk harm not only to themselves, but also to everybody whom they meet or breathe on. How do you get people to take the medicine that's good for them?
Yeah, that's a very good question. And I think we have to meet them where they are. You may have doubts, there may be uncertainty, and the vaccinations have been developed in record time. The quality standards are the same. It has just been done more agile. So these vaccines are really good vaccines, and you should take them because you're not only protecting yourself, but you're protecting the others, and you're stopping the pandemic. But I think we have to understand the people who have reservations, listen to them, talk to them, explain it, and hear their concerns, meet them where they are, is my answer, because I think together we can achieve more.
Okay, that's a very good answer. But I mean, we're also seeing governments doing a bit more than listening to people. There's also a degree of pressure of things like, you know, in France and indeed in Austria, you cannot go into a restaurant or a public place without proving that you have been vaccinated. And that's hugely increased the number of people who got vaccinated. Do you think that's a good idea?
It has pros and cons, right? So I think there's 2G rules, right? So if you're recovered or vaccinated in Germany, you call it 2G. And whether you have a negative test, that can also help. I think the stricter rules may facilitate more vaccinations. I don't want to call it forcing people, because forcing people is never a good idea.
Not quite forcing, but it's saying if you want a restaurant meal, you need to show a vaccination certificate or a test. So it's strongly pressuring people. Okay, well, I mean, different countries are going to approach it in different ways. Let me go to Maya Matthews, who's joining us remotely. You'll see that the results of our poll here from audience members, both here and remotely, was that most people think that the COVID-19 has indeed transformed the healthcare sector. You have a continent-wide view on that. What do you think are the most important ways in which it's changed it?
Thank you, and I'd also like to take this opportunity to thank the forum for inviting me. Yes, I mean, I think that what we've seen, what we've witnessed, as you said, was a healthcare revolution. It was of no one's making other than the virus, and it led to a huge acceleration and leapfrogging of the whole digital health agenda. So I think that would probably be, if there's one thing that we should look at, it is how the use of teleconsultations, the use of information, and I'm talking even about epidemiological information, has absolutely increased. I joke a lot with people that epidemiologists have become like gold dust in the last year. I think the whole way information has been circulated, the whole issues around data privacy, of course, these are all massive issues. We always knew about them, but they've been really brought to the fore with the pandemic. What we're also thinking about now within the European Commission, and I should say, and to your audience, I'm sure you're aware of, that of course health systems are the responsibility of member states, their organization, their delivery. Where we can help in the EU is bringing countries together, cooperating, and also providing, as you said, this overview, this information. And so it'll be interesting to see, especially with the teleconsultations and the use of telemedicine, whether this is here to stay or whether it was just a transitory blip. So that's one area that I think is an important discussion point. The second one is, again, the pandemic exacerbated existing structural weaknesses in health systems. One of the biggest ones, as we all know, is the shortages of health workforce. And we saw in the pandemic that in many countries, the workforce we were not able to have a huge surge in workforce, which is what's needed when there are crises. The workforce is not necessarily agile or flexible. And these are the kind of issues now that I think if we look forward about the lessons we can learn from the pandemic in terms of how we can strengthen the health systems, make them more resilient. These are probably the two main issues, the data, digital, and how to address the workforce and have a workforce that can be quickly remobilized if necessary to intensive care wards, for example. Okay. One more issue, if I can just bring that up and then I will stop, okay, is I wanted to make a pitch for public health because I think that the pandemic has shown that the importance of public health, the importance of having a good surveillance system, the importance of testing and tracing, and in many countries around Europe, this was seen wanting because there had not been enough of an investment in the whole public health infrastructure. So I think if we're talking about a healthcare revolution, it's very important that the basics, the nuts and bolts of public health are also given investments. Thank you.
I'd like to bring in Arjan Tour here. Thanks very much, Maya. You have a different kind of overview of what's going on in the health sector, running one of the world's leading health insurance companies in Europe. How big a revolution does it look from where you're sitting?
Yeah, thank you, Robert, and thank you for the opportunity to be with you today. So maybe a couple of things from my perspective. First and foremost, I think what COVID-19 has done is it has placed health higher on the agenda than it's ever been before. I would argue that's actually a silver lining. I think COVID-19 has served as an ugly but incredibly impactful reminder to all of us how important health really is, right? And if our health is under threat, really nothing else matters. And I think we see that at an individual consumer level, where a lot of people are actively seeking for better health protection and health insurance solutions. We see that at an organizational level, where employers are really stepping up to provide better health solutions to their individual employees. And of course, we see that at the government level, where, as we just heard, there's an increased focus on health and health solutions to try to address not just the fallout from the pandemic, but also going forward, improve our overall resilience. So that's definitely one thing that we're observing. The other thing I would call out is the fact that I think there's a real, call it redefinition of health. So if you think about COVID-19, a lot of people have been directly infected by COVID-19, but many, many more people have been impacted by COVID-19 through increased levels of anxiety, increased levels of stress, loneliness, lack of exercise. People have gained weight, people have fallen out of their normal routines. People have been increasingly worried and are still increasingly worried about their future and their financial future. And that all has a significant impact on people's health and well-being. And one of the annual surveys that Cigna does to understand better how people are viewing their health and well-being clearly highlighted that more than 70% of the people actually feels that their mental health has a significant impact on their overall health and well-being. So going forward, when we talk about health, it's really important that we stop talking about just physical health and the direct threats to people's physical health, but we look at health much more holistically. In Cigna, we call that whole health. And I think that's an important trend for us to recognize and effectively address going forward. The third big change, and this is where I would like to support the comments made by Maya Matthews, is virtual health. So we've seen an incredible increase in the utilization of telehealth, 500% increase over the past year and a half compared to prior to COVID-19. And I absolutely agree with her that that's here to stay and poses a lot of interesting challenges, but also opportunities for us as an industry around how we fully integrate virtual health into the overall health ecosystem.
Those are all great points, but can I press you on the mental health front? Now, clearly, mental health is a problem not just for people who suffer poor mental health. I mean, it can be very traumatic and unpleasant for them, but it also affects people's productivity. It affects the people around them. It affects their families. So I'm wondering what you're seeing in terms of what's working for people to sort of deal with the isolation. I mean, for some people, the best mental health intervention is clearly vaccination, which doesn't directly affect your mental health, but makes you less frightened of catching the disease. But what else, apart from vaccination, are you seeing that's working, dealing with this fairly new set of symptoms that people are having with COVID-19 isolation?
Yeah, it's a great question, Robert. And as you probably know, we partner with a lot of large employers around the globe, intergovernmental and non-governmental organizations, large multinational corporations, but also smaller, medium-sized enterprises. And what we see is that employers play a really, really important role in effectively addressing mental health in the workplace and providing their individual employees with the right level of support. And by the way, employees are increasingly expecting their employers to step up and do just that. So what we see working really well is employers creating an environment, a safe space in which individual employees feel free to talk about mental health, to talk about stress, to talk about burnout, to talk about all these issues that we just mentioned, because that's where it all starts. If we are able to remove the taboo and give people the opportunity to talk about this, that's the first step towards effectively addressing it. Secondly, there's a lot of programs that we put in place in partnership with these employers to make sure that when people do suffer from mental health issues, that they have access to the right care, and that sometimes can be self-help. Sometimes it's really about providing access to mental health providers. So I think that's another really important thing that employers need to do to make sure that we tackle this heads on. And then thirdly, we also need to fundamentally rethink the way people work. So if there's one thing that COVID-19 has taught us, it's of course that the physical location that an employee is in is no longer that important. And I think going forward, employees are looking for much more flexible working arrangements. And employers have an important role to facilitate that and move to new ways of working, more hybrid ways of working that give people the opportunity to balance their private priorities and their work priorities in a much more organic way.
Yeah, of course that cuts both ways, doesn't it? Because if you're able to work flexibly, it does mean that it's easier for you to drop the kids off at school, but it also means that your employer can get hold of you at any time, which means you have to be sober all the time. So I'm going to ask some questions about innovation, because I think, you know, when you have a big shock like COVID, it forces people to think in new ways. And I'm going to start with Konstantin. I guess the question is, you know, we've heard a lot about the extraordinary power of mRNA vaccines. Now, they weren't invented because of COVID. That technology was there before, but it really came into people's consciousness with COVID-19. We saw the power of being able to develop a vaccine very fast and very effectively because of that technology. But what are you seeing? What is the concrete innovation that's come to the fore or come to your notice during COVID-19 that you think is most impressive, that people maybe haven't heard of?
Well, thank you, Robert, for this question. It's a great question, but you know, I wouldn't say that mRNA or adenovirus vector, those are the new technologies or innovative technologies that will be used in a really fast pace in the world. You know, for 30 years we have been developing the mRNA technology. Or, for example, the Novavax company from the US that has developed a vaccine with the nanostems. This technology is 25 years old. And this company is now costs more than $15 billion at NASDAQ, but still, they haven't yet sold not a single bottle of these vaccines. And this was the very first usage of these vaccines that use these technologies on the nanostems in the world. We cannot speak about this long effectiveness of these vaccines because we never had the really long-term clinic research on that. And speaking about also specific moments of how the cells are going to be taken out of the organisms after the main reaction will be taken. Moreover, it already has been proven that at least 19% of the malicious cells have been created due to the virus-caused activity. So mRNA, and there is a hypothesis like this, that mRNA technology can be a really disruptive breakthrough technology to resolve the problems with cancer, to resolve the oncology problems. And the main companies like Pfizer, the one have created those vaccines for the very first time, they're already working on those technologies in this direction. So basically, I wanted maybe to clearly outline that the COVID-19, it didn't kind of accelerate the process of developing of all those kind of vaccines. The COVID has accelerated the regulatory function. The world have no other chance than to provide those vaccines to the market. Because inactivated vaccines we only had in China, the CoronaVac in China. And I do believe that soon we will receive additional information in what way they happened, why did they have it in China so fast. The inactivated vaccine, where we have either the dead virus cells or the weak virus cells, it can't be created in that fast pace. But let us hope that the mRNA will give a lot of breakthrough for the molecular biology, especially resolving the oncological issues.
Much for that. I'm going to turn to Maya now and ask if you think there are innovations in government or regulation that firstly seem to work and secondly that you think might outlast the crisis. What's the smartest thing you've seen produced in Brussels or elsewhere? Good
question. I mean, I think, as I said, and I think Ion actually said it, I probably should have said it as well, the fact that health is actually risen to the top of the agenda, I think that's actually a big innovation in itself, because you know, I've worked in health and public health for 25 years, and you know, it was never top of the agenda. There were small crises, let's say Ebola, where I was working on that, and for a while everyone felt, okay, this is going to happen. We're going to have you know, a new crisis preparedness that went through the UN, and then unfortunately, a few months later, it was forgotten, and now we've had the big wake-up call that everyone was expecting. So I think in terms of regulation, there needs to be organizational change or regulation. We've seen actually from the EU perspective, we haven't changed any everything we've done so far in health has been within our competence, within our treaty. We haven't changed anything, but what we probably have done is been smarter at being more agile, quicker in implementing things, and also trying to, I think there's a lot to be said for just trying to work closer together with member states. I would say that in terms of organizational innovation, I think that's been one of the clearest things, that before there was this huge outcry at the beginning of the pandemic, you know, why isn't Europe helping? Member states were asking for PPE, and within the EU, we did not have the competence to provide that. We could send vaccines for animals because food and veterinary is part of the single market. We could not do the same for human health. So we had to look very carefully at what we could do and what instruments we could use to bring together resources and then be able to deliver them. And I think the example of the advanced purchase for the vaccines and also the joint procurement that we did for PPE for many member states, that showed that we were able to act with what we had.
Thanks very much. And of course, there was quite a lot of economic policy operating on the healthcare front as well. I mean, the ability of government, certainly in the rich world, to spend unprecedented amounts of money to persuade people to stay at home, to the furlough schemes, and the ways of keeping people's incomes up so that they didn't have to go out and mingle. And we don't yet know what the full effect of that was, but we do know that there are lots of countries in the world where they didn't have the financial wherewithal to do that, and the results have been quite bad in public health terms in places like sort of Mexico, for example, where the death rate, the true death rate, has been very high, certainly much higher than it's been in rich countries. I'm going to ask Thomas a question in a moment about personalized medicine and what we've learned about that, and how it might help us with sort of, you know, COVID-19. But I'm also going to put a question to the audience, the second and final question for the audience to vote on, okay? And this, again, is on your phones, whether you're here or remotely. And the question is whether we will be able to prevent another pandemic without wholesale restructuring of the healthcare sector. So if people would like to vote on that, that will appear on the screen. And while you're voting on that, it's 1 for yes, 2 for no. Will we be able to prevent another pandemic occurring without wholesale change to the health sector? And I'm going to ask Thomas a question while you're doing that. You're an expert on the personalization of medicine, the science of making it so that the treatment is one that suits you as an individual, you as a person, you as a particular body type. How has that field advanced during COVID?
I think, first of all, vaccination does not need much personalized medicine, right? So it works for almost everybody, which is good news.
That's very good news, yes.
That's indeed good news. And personalized medicine hasn't advanced faster during COVID, and also not because of COVID, unfortunately. This is something, the digital piece that has advanced a lot, and you know, we've heard that may help the personalization, because I think ultimately personalized medicine will work together with all the data we have, and we have lots of data. We don't even know how much data we have. We have the machine learning.
We have a lot more than we did a year and a half ago, and a lot of it's in people's phones, and a lot of people are inputting it into those phones in a way they were not before because they realize it's an emergency. So that's got to help, right?
You're spot on. And then the question is, how can we use the data? Because all the data and the machine learning doesn't help. You need a human touch and you need common sense to make sense of it. And I think this is what we have to do in personalized medicine. My favorite example of personalized medicine is the following. 15 years ago, when I was still practicing, I had a person with type 2 diabetes. I was trying to make him inject insulin because the glucose levels were terrible. I had the insulin pen ready. His wife came along and said, oh no, no injections. We agreed on a dog. I said, a dog? What is a dog going to do? I never read about a dog in a textbook. would you believe it, that dog made that person lose weight? The glucose was the best ever. So since then, I think solutions that are out of the ordinary can make a dog.
A dog, like wolf.
Wow, a dog.
Wow. Dogs are superior to cats. I mean, if that's proof, right? Excellent. Okay, we've got some answers to this question online. So, gosh, 94% of you think we will not be able to prevent another pandemic without a wholesale change to the health sector. That's a pretty big proportion. I'm going to open it up to questions from the audience. So you can either raise a hand or you can send us the question online. If you raise a hand, I will indicate you and we'll get a microphone to you. So you can do that now if you would like to. Generally, the first people to put their hands up get a question in. Otherwise, I will go to taking one of the ones from down here. Okay, so one question is that what do you think are the biggest barriers to innovation in healthcare at the moment? Which of the panelists would like to take that? Konstantin, would you like to take that question? What are the biggest barriers to innovation in healthcare?
You know, with the emergence of COVID-19, I haven't seen that many barriers, but I've seen a lot of opportunities. Because basically 95% in the world, of people in the world, and like all of the TV channels have been spoken about the pandemic, about the new viruses. In Ukraine, the death rate has usually been like that. The first place on death rate was the heart diseases, the cardiovascular diseases. Then we've had the malicious cancer. There was other places that were taking some other deaths. Right now we know that COVID-19 death is second in our death rate. It will be even higher than the cardiovascular deaths in Ukraine. So unfortunately, under the statistics that we have seen in the 9th month of 2021, I think that more than 70,000 people will die just of COVID in Ukraine. So in our situation, I see no barriers for innovation. We have enough money in the sector. All of the companies, all of the startups that we've had, even if they have the minus EBITDA, so they now have a lot of money. There's a lot of money invested into this sector. So I think the biggest limits to that is knowledge. Because people do not have enough knowledge. We do not have enough knowledge. We're not really knowledgeable about everything that's happening. I just want to be understood. I want to be clear about that. The mRNA, the nanostamps that have been already known, but not the FDA, not the MI, none of the regulators have proven them for the market. Those companies have been sold in the exchange. They were worth of $1 billion, but not single authority decided to take this technologies to the market. Technology-wise, nothing has changed, unfortunately. These technologies are not perfect still, but understanding this abnormal situation, this really frightening situation for humanity, they've just managed to take that to the market. I agree to what Arjan Tor has said, that depression and the mental health is right now very important for the people. So the most important innovation from the regulators was actually to provide those vaccines to the markets, and we know there was no other way out to this. But right now, I think that there's no barriers to innovation right now, and I'm sure that in Ukraine we currently have the chance to keep on working on those topics. And I can give you an example on biopharm as well. I'm sorry for being too long, but I think it might be very interesting because it's very good example as well. 5 years ago, we had a lot of international consultants coming to us, the professionals from the European Commission. We had a lot of negotiations with the EU. We had ambassadors coming who have told us you should not build the plant on the blood plasma. You don't have to build up the plasma centers. We only have built those centers in the US, in Germany, in Austria, and in Czech Republic. All of the other, you should build the Red Cross systems, and you should not build the plants that will be able to disseminate blood plasma. We have listened to that and we even agreed to that, but we've still continued building our factory as well. We've invested $200,000. We have created 7 private plasma centers. We collected 250,000 plasma liters. So what happened this year? This year, European grants, the CSI, Grifols, Staccato, Octapharma, Thadrian companies, they have stopped the supply on the albumins and immunoglobulins to Ukraine. They have fully stopped it. The Octapharma has provided $120 per gram for immunoglobulins because in Europe there is the deficiency of this product already. But we have managed to cover this demand by providing the product that is going to be 3 times cheaper. You want to tell me that there's only the demands for Ukraine? No, this thing has happened the same in Belarus, in Kazakhstan, and the same has happened to Uzbekistan as well. We have explained it. I have the meetings with the government of Kazakhstan, Belarus, and Uzbekistan. We have explained them how important this is, and we have explained how, for example, the FDA and EMA has registered the non-Novavax, so how they registered the mRNA vaccines. They've registered our medicines as well, and we've covered the deficiency in Belarus, Uzbekistan, and Kazakhstan, as well as in Ukraine. Right now, we see the problems with the blood plasma product in Turkey and in other countries as well. I do hope that Biopharma will cover the demand in those countries as well. It is connected to this idea that the overall collection of the blood plasma has decreased by 20%, mostly in the US, because, it covers 75% of all of the blood plasma in the world, and it has fallen down by 25% during the pandemic. What do I mean by that? We have listened to the advice. We have been persuaded with it, but we've continued building our own sector as well. So I do believe there's the only one way for Ukraine to develop in this direction. We should follow our own idea, our own goals. We have shown that the world respects the strong, so we have to invest money into science, build our own research centers, build our own labs. We have to support our young people from the chemistry and biology faculties. We have to stimulate them stay here because we have a lot of space for the breakthrough, for the medical breakthrough, for the breakthrough of technology as well. I'm sure that we can already able in the blood plasma, we're able in the microbiology as well.
Much indeed. Do we have questions from the live audience, or I'm just going to do another one from the virtual audience? If you want to raise your hand, we can get a microphone to you. Okay, there's a lady at the back there. Can we get a microphone to her, please? And we do need the microphone to be there before you ask the question. Is someone giving her a microphone? That's great. Where is it? Lovely. If you could just introduce yourself so we know who you are and then ask a question, please.
Lana Sinichkina, Artsinga law firm. I'm doing legal consultancy in healthcare sector. Что я хотела спросить?
What I wanted to ask you, maybe I'm going to be slightly out of the topic, especially of the topic of the innovation in the healthcare sector. The one thing that I am personally worried about, that it is really hard for us to promote the increase of the budget for healthcare in Ukraine, because quite recently we had there was no changes for the Ukrainian legislation that will help us to increase the healthcare sector budget support up to 5% of GDP. But still, we're talking about innovation. We're saying that the quality of life in our country directly depends on the level of healthcare. It directly depends. This is the issues of the security of our people, the security of our population. At this very moment, people in Ukraine basically paying for their own health from their own pockets. And this is the difference between Ukraine and any other European country, for example. I have a question based on that. And maybe there is a question to our international speakers as well. How can we what can we do so that for Ukraine, for Ukrainian political stakeholders, the health of Ukrainian people would be a priority? What can we do about that so that our defense and security office would actually make different decisions, not to limit the advertisement of the medication, but to actually to increase the financial support from the budget for healthcare? Because we believe we can afford that. We have a lot of expenses right now for like construction of the roads, but not to the healthcare. How can we do to persuade?
I can put this to Maya, as you have an overview of how different countries have approached this very difficult question. You know, you want to have better health, but also you don't want to have higher taxes. What works?
Yeah, I mean, of course, there's the politics, and so I don't want to go there. I mean, health ministers, just an anecdote that, sorry, I have an echo, yeah. Health ministers are, let's say they have some of them have like 9 lives, you know. At the moment, there are countries, because as you said, we have the overview of countries. There are certain countries that have been through 4 health ministers in the last 18 months. It's a very difficult job because you're always asking for more money. And at the same time, when there are scandals, it's something that's so close to everyone's heart that you're often the one who is, you know, who is fired for that. My advice is basically build the evidence, show the evidence. You know, that's something that politicians can't dispute. You know, show the outcomes, show that if you invest in certain areas, you will get dividends. We've done that from the European Commission, for example, in the area of prevention. Prevention is usually, I mean, about 10, 15 years ago, we did some work where we saw that on average, member states spend 3% of their health budgets on prevention. And maybe we can do a poll and ask the audience, you know, 10 years later, do people think that that figure has changed? And the answer is no. It's oscillated maybe between 4.5, 2.8, but it's still firmly set at 3%. So I think that trying to get countries to invest more in health as a whole is very difficult. Remember that the political cycles are short, and often if there is an investment, it'll go into a shiny new hospital that you can see with the plaque of someone's name. But the issues that we are really working with, which is the sustainability of health systems, which is the long-term access issues. I think the audience member mentioned the out-of-pocket payments. Those are the really nuts and bolts of how you can have an efficient and accessible and a resilient health system. There you need to build the evidence. You need to have the facts so that you can go to the politicians, you can show that, you know, it's really important to have that. I would say for me that would be one area that you could try to build on.
Okay, great. So you want to say something specifically about Ukraine, right? Go for it.
I know that you made this question for our international guests, but you know, I live in this country, I pay taxes, and I pay lots of taxes as a head of the plant. You know, Ukraine provides $5 billion. This is slightly more than 3% of Ukrainian GDP. But I will give you another example, maybe from biopharma, that illustrate that. We have a Dnipro blood transition station that is mostly municipally owned. They have 700 people working, and it provides 6,000 liters of plasma per year. In our private plasma center, we have 80 people working. We also provide 6,000 kilos for 4 weeks, in 4 weeks. So before you actually, you know, before we have to choose what to do with all of those loopholes before we invest a lot of. We can give 5%, 10%, but we have to make the structural change to make the system effective. I would like to give you another Ukrainian example. In Ukraine, we have 2 sectors of healthcare that for 100% been privately owned. The first is the dentist services, and the quality of the dentist services in Ukraine, in some cases, is sometimes even better than the European dentistry, and even better than in the US, because I have a lot of people coming to Ukraine to cure their teeth, and we have hundreds, thousands of people who are working there, and no one will go to the state clinics to make their teeth done. The second story for Ukraine is the reproductive medicine. The technologies have started to be developing after the Soviet Union outbreak. We already have private clinics on reproductive medicine. We have people from Europe and Asia coming here. They're working with extracorporeal pregnancies, and we have lots of sectors. There are absolutely private healthcare sectors. So the faster we step out of populism, the faster we starting using these populistic motives, the sooner everything will get on its places. We should not search for the easy solutions. We have to work hard. And even the questions of providing the artificial lung ventilation in the 2020, the issues of vaccine supply to Ukraine, the issues of the target medicines for treating the oncological diseases that cost at least 1.5 million for 3 months, it only gives us the understanding that we have to manage our problems on our own. Only the strong will be talked to.
And the live audience like to raise a hand and ask a question. Otherwise, I'm going to go with one of the virtual ones, which is a couple of people have asked, given that women have borne more of the burden of COVID-19 than men have, and there's been in some places a change in priorities of healthcare to really sort of focus on that. This is a question for Arjun, I think, because you have a broad overview of what's going on. Firstly, do you think that the response, particularly for women, has been adequate? And secondly, do you think it can be sustained as the pandemic recedes?
Yeah, thanks for the question, Robert. And I would like to start where Maya Matthews left off when she started to talk about prevention, and I'll get to your
Sure.
question in a moment. But one of the things I believe we've not spent enough time on, not just today, but over the past year and a half, is to talk about resilience. You asked the question to the audience, right? How do we prevent the next pandemic, or how do we prepare ourselves for that? The reality is we have to improve the resilience. And if you look at the people that have been most impacted by COVID-19 over the past 18 months, we all know that those are mainly the people with underlying medical conditions, right? People that are most vulnerable. And many of these are non-communicable diseases. And again, that's not a new topic. We all know that that's on the rise across the globe. And that's really now come back to bite us from an impact perspective if you think about the global pandemic. And what I'll ask myself and the others on the panel is, so how much are we actually doing to improve that structural issue of resilience so that when there is a next pandemic, and unfortunately that's one of the few things that all experts seem to agree on, that there will be a next pandemic, we are much better prepared. So despite all the important conversations about vaccinations and social distancing and all of those things, at the end of the day, if we become healthier as a population, we will become less vulnerable for future pandemics, right?
Okay, great. So, I mean, we're going to come back to that in just 1 second. And if you can answer the women question, I'm going to ask everyone to come up with their best ideas for how we can be better prepared for the next pandemic. But women first.
Yeah, so the short answer to your question is no. I don't think that we've done enough to specifically address the challenges that women have faced and are still facing when it comes to COVID-19. We need to go back to the social determinants of health and really understand why it is that certain people are less likely to be healthy and therefore more resilient than others. And that's what we have to address. And that's a much bigger and more complex conversation than just finding another vaccine or solving for the short-term issues that COVID has created.
Okay, so let's go to the big question. How to prevent the next pandemic. Thomas, would you like to go first on that? What's the one big thing that we should be doing?
That's a very tough question, and I'm not sure I can answer it, but I'm going to give it a try. We may not be able to prevent the next pandemic, but we can probably do better. And I agree very much with more healthy behavior. Prevention, when I heard that, right, I was smiling because I think prevention is the key. It doesn't give you short-term benefits, but people's lives get so much better, and that improves the resilience. So with a healthier population, you are in much better shape to prevent the pandemic. concretely, I think there's one piece that always bothers me. Perfection is in the way. And I'm going to explain what I mean by that. And the regulators have been good. And the European Union and some governments, they relaxed a little bit with their rules because we are aiming for perfection when we look at healthcare. We don't need perfection, we need progress. We need to make sure we guarantee safety and we look at patient benefits, but we do not need perfection. You cannot exclude the uncertainty. It's the human body, right? One of the most wonderful miracles in the world. So perfection is in the way, in my opinion. It's progress, not perfection that we need.
Okay, so you mean that the drug approvals process should be faster? Is that what you're saying?
That could be one of the conclusions. And for vaccines, it was exactly true, yeah.
I mean, it was pretty fast. But, you know, if you went for perfection with a COVID-19 vaccine, if you said, let's have one where there is zero chance of any bad side effects on anyone, then you'd have no vaccine and lots of people would die. So, you know, there's a trade-off between speed, effectiveness, and, you know, side effects. Let's have Maya. What do you think is the big thing that we need to do to minimize the next pandemic?
Yeah, I think that, I mean, as the other speakers have said, it's a huge question, but I'd maybe like to touch on something that hasn't already been talked about, and that's the importance of intersectoral working. I mean, this is called a healthcare revolution, but it's so important that all the different parts of the government and other stakeholders are involved. I think that's the only way. You can't compartmentalize a crisis. What we saw in the European Union was that, you know, the minute the virus started transmitting, then all other areas of our lives were also impacted, you know, from the rail, the transport across borders, when borders started closing. So I think that to really prepare, it has to be a cross-country, cross-government approach. I think that's the only way that we're, from the research labs level to have very good alert systems, to how we deal with schools and children and education. You know, I really think that we need to think much bigger. We have to be even more revolutionary in our approach.
Okay, there was a question there in the audience, so I'm going to go to the gentleman there. Okay, if you could say who you are and...
Yeah, thank you very much for giving this opportunity. I always think, have we made a mistake at the beginning of pandemic? Because, yes, vaccination is a solution. It's an important solution for this fight against COVID-19. But at the same time, antiviral tablets, because we are talking about RNA virus. It is always mutating. Always we have to develop vaccines. We have to modify the vaccines and so on. It will go on like this. I mean, so here nobody is talking about antiviral tablets and other type of solution to this problem. To my mind, sometimes I think, have we made a mistake at the beginning? We too much concentrated on vaccine development, ignoring the antiviral other solution like tablets or whatever. Right now, we are hearing from some Pfizer company and others that they are developing such tablets. My question is for Mr. Thomas. Thank you.
Okay. This is a very good question, and I think yes and no, because we need both, in my opinion. We need the vaccines because they prevent the viral infection, or at least, you know, decrease the severity once you are infected with the virus. So that makes a lot of sense. But you need also the antiviral treatments, which is symptomatic treatment, yeah? And both together, I think, provide a much better solution. And there's many companies working on these, right? There's things that have been used for other, you know, diseases that have an antiviral effect. We don't have the perfect symptomatic treatment against the virus when it's there, so I think we need both. So therefore, there's no easy yes or no answer. Have we forgotten something? Did we do something wrong? But indeed, it's a very good question. We need both, in my opinion.
Okay. Are there any more questions from the audience? Yes, there's a lady in the middle there. If you can get a microphone to her, please.
Thank you. I have a question to Konstantin, because basically right now, at this very moment, the issue of vaccines is very important and relevant. And in Ukraine, we have a lot of people who doesn't support vaccination at all. We have a lot of vaccines that have to be done annually. For example, the vaccines around against flu, for example, and the coronavirus vaccines as well are not being trusted. Do you believe that this lack of trust is in some way can be explained in Ukraine with the lack of the research that we've had, or should we increase the level of trust to the state and to vaccination overall? Thank you. Well, thank you very much. It's a good question considering Ukraine, but you know, we don't have, that's not the trust that we do not have. We do not have knowledge about that. You know, when in March 2020, the country has been on the lockdown, and we had a very harsh limitations, even in the publications, like, for example, big net publications like Ukrainska Pravda we had these articles that's on the pack of shrimps that has been carried with a minus 50 degrees environment, the coronavirus will still live. You know, it is against the nature of what virus is. Virus does not exist outside the cell. So basically, any kind of RNA virus can survive without the body, without the cell, no longer than a minute. If the viruses could survive the temperature minus 50 on the pack of shrimps, the humanity would never survive. So, you know, there is a joke on Facebook that there are people who believe that the vaccination is going to change their DNA. They should consider it a chance to become better. So basically, if we have to learn, we have to educate people. We need to have good level of education. That's it. I'll give you an example from what I know from our businesses as well, and from biopharma thing. That's a very simple topic that is known to the Western Europe, USA, and all of the educated world. The rhesus conflict. When the rhesus negative woman expecting a baby, there is a 17% of probability that she will have a rhesus conflict with the baby. It will not be possible if her husband is the father of the child is rhesus negative as well. 50% of Ukrainian women, they do not receive the anti-rhesus anti-globulin, but this will help us to resolve this issue completely. That's because of the lack of awareness in our country. We lose around 100 children that either are being born dead or either not being born at all because they have the gynecological diseases in Ukraine. Part of those children, those are the children who will have disability till the end of their life, and some of those children that have been born, they're going to have also the delay in development, and you know, the parents will not understand why their child do not talk till age of 5. So this is because of lack of awareness and knowledge. So the question here in vaccination is not about trust, is about education, the basic education. You know, we used to, calculate the perimeter of basically of any kind of figure. Then we used to know how to do that. But right now, our education only gives you the different colors to different shapes. Right now, I do believe that sometimes people do not understand the elementary things. I would also like to reflect on the question on antiviral treatment. You know, we don't have the real antiviral treatment tablets in the world. We only can cure the symptoms, as my colleagues have said. You know, the paracetamol, whatever you called it, Fervex, Coldrex, that's just paracetamol. That's it. So right now we don't have those antiviral treatment except for the symptoms. So right now the most effective treatment for that is vaccination and prevention. And those pandemic as COVID is, we will never be able to prevent them or forecast them, because we can only respond to what we know and only respond to what we know that we don't know. But we cannot respond to something that we're not even aware of. We do not know what kind of a black swan can land in our playground.
Almost out of time, so I'm going to give almost the last word to Arjan, and I wondered what your go-away thought is on how we can deal with pandemics better.
Yeah, thank you, Robert. So from my perspective, what's really important is that we focus on resilience, as I already mentioned, and improving the resilience. And for us to be able to do that, we have to effectively address some of the underlying issues that have come to the surface through COVID-19. So when we think about overall health and well-being, and it's kind of ironic that in a way the lockdowns that we've experienced in many countries have done the opposite, right? We've told people to stay inside, not to move around too much, not to be too active, whereas we've potentially should have encouraged people to be out more, to be more exercising, to be more active, because those are ultimately the things that are going to help us structurally and longer term. So what I think we need to do, and that's also very much to the point that Maya Matthews made, is we need to start to break down the barriers between governments, companies, employers, payers and healthcare providers, and really start to work together much better to try to address this larger underlying health crisis that we're still faced with. And I'll finish where I started. The fact that health is now higher on the agenda than ever before creates a fantastic opportunity to do that. There's a high health awareness. People are willing to engage on this important topic. So this is the right time to really put the focus on improving our overall resilience by improving health and well-being overall.
Thanks very much. So I'll end it there with just one thought, which is that the virus, like all viruses, it reproduces much faster than people do, and that's bad. That gives it a huge advantage over us. But I think the discussion we've had today highlights the fact that human beings think a lot faster than viruses do, and that's what gives us the advantage in the fight against them. They, of course, don't even know they're in a fight. We have the ability to, when we're hit with a big problem, to think about new ways of resolving it, and eventually, even the people who resist science catch up and start taking their vaccines, we hope. So with that, I would like to say thank you very much to my distinguished panelists, to Konstantin, to Thomas, to Maya, and to Arjan, and to our sponsors, UFuture. And thank you all very much, the audience, both the people who came here and the people who are watching in the four corners of the world. Thanks very much, and I hope you enjoy the rest of the conference. Goodbye.